What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering how do X-ray checkoffs / comps, or whatever your place calls it, works when you're in clinicals. So, to give you context, I'm an X-ray tech. I've been doing it for 4 years, 7 on, 7 off. I have a lot of day shift also, a lot of overtime. So, to give you context, both for nursing and X-ray, because my lady's a nurse, our whole setup versus theirs is completely different, checkoff wise. For X-ray, it's kind of a little bit more easier compared to being a nurse, just checkoff wise. Every hospital or every place you go to, you have different techs, right? Certain techs are more, what would the word be, lenient, or more work with you, or more, some are more stricter than others, just based off of the rip. Certain techs, you can do everything perfect, but if your marker wasn't there, or maybe the technique was off and maybe the picture wasn't good, they won't give it to you. Kind of sucks, but they are the techs, and you are trying to get the check off with them, so you'll dabble with different situations. Me personally, if you're gonna get a check off with me, I'm like, okay, as long as your positioning is good and you're communicating with the patient, everything is good. Your marker, at certain situations, I understand why you wouldn't put your marker, or maybe you forget, but as long as the actual essence of the job is good and you understand it, and that's probably how I would have done it, I'm gonna give you the checkoff type situation. Other techs are a little bit more different, I would say, in that regards. So yeah, it can vary by a lot. Like, there's some times where there's people who they wouldn't give you anything, and other techs are that it all kind of varies. But like, your teacher doesn't have to be there. It's just X-ray techs versus X-ray techs. Like, certain ones are more like, even as a student, you can quickly pick up who's like more old school. They'll run stuff a little bit different versus certain other techs. It will vary, I would say. So keep that in mind, both for any kind of X-rays, both like L spines, C spines, certain spines. Like, the placement of the marker is harder. Like, certain techs, like, I would rather not have my marker there than it be there, but it get shown into anatomy. But a student, I understand you're like kind of trained that I have to have my marker there, or else it don't count. So it's kind of a risk versus reward. So it all varies, but it's not really hard. It's more of a how easy it is, because like, some people, you're gonna have to work for your checkoffs, because like, every patient that come in there is like dying, and it's like their stuff is broken, and so you'll have to like do a little bit more harder work, I would suppose. Sorry for the camera, the roads suck out here, but you'll have to kind of work to earn your stuff. So it all varies. Same thing with like, if there's a baby versus an adult, PD, whatever, it can kind of vary as far as like the age range. Certain hospitals, their pediatrics will count for X amount of age, versus other hospitals, they have to be, it all kind of varies. Same thing with like your trauma shoulder, your trauma hips will vary. Other ones have to be like true trauma. Other ones, they don't have to be true trauma, as long as you still cross table, that you're still considered. Like, at our hospital, if you shoot a shoulder in the emergency room, technically it is considered trauma, because you did shoot it in the ER. Now, as far as like trauma hip, or the Daniels-Miller method, cross table, that's a little bit different. You can't just shoot a regular hip and count it as cross table. Like, no, you have to do it certain. So it all varies. But like for nursing, your clinical instructor has to be there to get their check off. Like even other nurses don't have to be there. They're like, yo, if she's gonna do a check off, I gotta be there. So the stress could be way more, I would say, if you go that route. My lady would tell me how stressful she would be. Hell, even when we were in X-ray school and you would just be pretend mocking like X-rays with just your clinical, with your teachers, I could see how certain people would be nervous, let alone an actual patient was hurting, who was in pain, how it could bring your nerves up even more. So it's overall, it's not hard. It's like see one, do one, and then comp one. That's kind of the scenario I've always been in. So yeah, it's been your one we go. See you on the next one.